Have you ever considered that a common pain pill or sleep aid could be quietly putting extra strain on your heart? Around 1 in 4 older adults uses over-the-counter pain relievers regularly, often without knowing the possible effects on blood pressure or fluid balance. You may also be taking medications for sleep, acid reflux, or mood that seem harmless, but can change how your heart works over time. In a moment, I'll reveal 7 widely used drugs linked to higher heart risk in seniors. Before we start, let me know in the comments where you're watching from. I'd love to say hello and hear your thoughts. Number 1, calcium channel blockers. Calcium channel blockers act on cells in blood vessels and heart muscle. They reduce the entry of calcium into these cells. In blood vessels, this leads to relaxation and wider vessels that can lower blood pressure. In the heart, calcium channel blockers can slow the rate at which electrical signals travel. This can reduce heart rate and the force of each beat. In many cases, these effects help manage high blood pressure or chest pain. For seniors, though, changes in how the body handles drugs and a heart that may be less robust can make these effects harder to tolerate. As the body ages, the way the liver and kidneys clear medications can slow down. This can allow higher drug levels to build up. When blood vessels relax too much, blood pressure may drop suddenly when standing or walking. That can cause dizziness or fainting. A fainting episode in someone over 60 can lead to a fall and injury. In the heart, slowing of electrical signals may cause symptoms such as a slow pulse, fatigue, or even episodes of feeling lightheaded. If the heart is already weaker, a further reduction in its pumping rate or force can cause the person to feel more tired or winded when doing normal tasks. Beyond changes in heart rate and blood pressure, some older calcium channel blockers can cause fluid to pool in the legs. That shows as swelling around ankles or feet. If fluid builds up in the body, the heart must pump against more volume. This can make the heart work harder and over time may contribute to a decline in its function. Shortness of breath, especially when lying flat or during light activity, may develop. Seniors may chalk these signs up to getting older, but they may stem from a drug effect. Interactions are also a concern. Many seniors take several medications for blood pressure, cholesterol, diabetes, or other conditions. Certain calcium channel blockers can alter how the liver breaks down other drugs. This may raise levels of other medicines, leading to side effects. It can also reduce the dose of a heart medication without clear warning. Regular checkups and blood tests can catch these issues. A doctor may adjust the dose or switch to a newer drug that has a gentler effect on heart rate or fluid balance. It is not safe to stop any heart medication suddenly. That can cause blood pressure to rebound or chest pain to return. The right approach is to review each medicine with a doctor. If a calcium channel blocker is needed, the doctor may start with a low dose and monitor blood pressure, heart rate, and signs of swelling. If side effects appear, the doctor can suggest an alternative or add a low-dose diuretic to manage fluid. Seniors should keep a record of any symptoms such as dizziness, swelling, or changes in activity tolerance. Sharing these details helps the doctor detect problems early. Number 2, proton pump inhibitors. Proton pump inhibitors reduce stomach acid by blocking a key enzyme in acid-secreting cells. They help relieve heartburn, acid reflux, and ulcers. Common names include omeprazole or pantoprazole. For short courses, they bring relief when acid irritates the esophagus. However, long use can affect nutrient absorption. In seniors, this matters because nutrient levels may already be marginal. Stomach acid helps absorb magnesium, calcium, and vitamin B12. Over months of PPI use, low magnesium may develop. Low magnesium can lead to irregular heartbeats or muscle weakness. Seniors may feel tired or notice a fluttering in the chest. In some cases, serious arrhythmias can follow if magnesium falls too low. Beyond magnesium, low B12 may cause fatigue or nerve symptoms. Though this may not directly weaken the heart, fatigue can reduce activity and overall fitness. Poor gut function and shifts in bacteria can promote low-level inflammation. Chronic inflammation links to heart disease risk. Though the exact connection between long-term PPI use and heart events remains under study, observational data suggest higher rates of heart concerns when PPIs are used for many months or years. That does not prove cause and effect, but it calls for caution. The main goal is to treat the underlying reason for reflux rather than cover symptoms with a pill indefinitely. Lifestyle changes such as raising the head of the bed, avoiding large meals at night, or limiting foods that trigger reflux can help. If a PPI is needed, use the lowest effective dose for the shortest time. Periodic review by a healthcare provider is important. A trial of stepping down to an H2 blocker or using antacids on demand may work once healing has occurred. Lab tests can check magnesium or B12 if symptoms arise. If levels drop, supplements may be needed or the PPI may be paused under guidance. Seniors are more likely to have other conditions requiring medications. Some drugs interact with PPIs by affecting how the liver processes medicines. That may alter levels of heart drugs or others, risking side effects or reduced benefit. A doctor or pharmacist can review all medications together. Regular checkups and simple blood tests can spot nutrient deficiencies early. If you have been on a PPI for several months, ask your provider whether a step-down plan fits your situation. If heartburn returns, use short-term relief measures or different agents under guidance. By treating reflux in a targeted way, you lower the chance of nutrient issues and unknown long-term effects. If you notice new tiredness, muscle cramps, or a racing heart, mention PPI use when you see your doctor. A safe plan for acid control can support digestion without quietly adding strain on the heart. Number 3, decongestants. Decongestants such as pseudoephedrine or phenylephrine narrow blood vessels to reduce nasal swelling. They ease nasal congestion from colds or allergies. Many over-the-counter cold remedies include these. They work by binding to receptors that constrict vessels. While this relieves a stuffy nose, it also raises blood pressure. In seniors, blood vessels may be stiffer and blood pressure may already be higher. Adding a decongestant can push pressure up further. This extra load makes the heart pump with more force. Over time, repeated spikes in pressure may harm blood vessels and heart muscle. Beyond blood pressure, narrowing of vessels affects blood flow to various organs. That may cause dizziness or headache. In someone with known heart disease, the extra workload can trigger chest discomfort or irregular heartbeat. Palpitations or a sense of fluttering can follow a single dose in a sensitive person. Anxiety or jitteriness sometimes occur because the drug also stimulates parts of the nervous system. This can worsen feelings of restlessness or trouble sleeping. For seniors, sleep disruption can reduce the healing and restoration the body needs each night. Some may not link a brief period of nasal relief to these risks. It may feel safe because it is sold without a prescription. Yet seniors often take multiple daily medications. A decongestant can interact. For example, certain blood pressure medicines may counteract the effect, leading someone to take more of one or the other. Or a doctor may raise a blood pressure drug dose without realizing the patient is taking cold medicine. Over time, this cycle can destabilize blood pressure control. If you have high blood pressure, heart disease, or a history of stroke, talk with a healthcare provider before using any nasal decongestant. In many cases, saline sprays or nasal rinses give relief without systemic effects. For allergies, non-drug measures or antihistamines without decongestant action may help. If a decongestant is needed briefly, monitor blood pressure before and after use. Keep a record of readings and symptoms such as headache, chest tightness, or palpitations. Share this information with your provider. During seasonal allergies or a cold, check with a pharmacist or doctor before reaching for a cold pill. They can suggest a safer option or guide how to use a decongestant for the shortest possible time. If you notice any rise in blood pressure readings, stop the decongestant and seek advice. By choosing gentler methods first and keeping close watch when needed, you protect the heart while still easing nasal symptoms. Number 4, tricyclic antidepressants. Tricyclic antidepressants such as amitriptyline or nortriptyline were once mainstays for depression, anxiety, or chronic pain. They work by altering levels of certain brain chemicals. However, they also affect other tissues, including the heart. In seniors, the heart's electrical system becomes more sensitive to changes. Tricyclics can slow electrical signals and affect heart rhythm. This may show as an irregular beat, a pause, or a block in signal conduction. Any disruption in the heart's rhythm can lead to lightheadedness or fainting. It can also worsen an existing arrhythmia. Beyond electrical effects, tricyclics can cause low blood pressure when standing. A senior may rise from bed and feel dizzy or weak. That can raise fall risk, and a fall can lead to serious injury such as a hip fracture. These drugs also have anticholinergic effects. That means they reduce certain nerve signals, leading to dry mouth, constipation, or urinary retention. While these may seem unrelated to the heart, dehydration or bladder issues can strain the body. Dehydration may thicken blood slightly and affect circulation. Some seniors may take a low dose for sleep or nerve pain. Even at low doses, the heart risks persist. Over weeks or months, small changes in heart rhythm may go unnoticed until a bigger event occurs. A senior might dismiss mild dizziness or fatigue as normal aging. In truth, these could be early warning signs. Safer options exist. Newer antidepressants have less effect on heart conduction. If mood or pain needs treatment, discuss a plan that weighs benefits and risks. If you are on a tricyclic antidepressant, have a baseline ECG and periodic checks. Note any new symptoms such as palpitations, dizziness, or changes in exercise tolerance. Keep a list of all medications and share it with each provider. Avoid self-adjusting doses. If side effects appear, ask about switching to a drug less likely to affect the heart. If a tricyclic is needed, use the lowest possible dose and monitor closely. Regular follow-up visits should include checking blood pressure when sitting and standing and asking about any fainting episodes. By staying alert to subtle signs and choosing safer medicines when possible, you can address depression, anxiety, or pain without quietly adding risk to your heart. Open communication with your healthcare team is key. Number 5, sedative hypnotics for sleep. Many seniors struggle with sleep and may use sedative hypnotic drugs such as zolpidem or older benzodiazepines. These medications slow brain activity to help with falling or staying asleep. They can seem like a quick fix after nights of restlessness. However, in seniors, the impact on breathing and heart function matters. Sedatives can reduce the body's response to low oxygen levels during sleep. If sleep apnea already exists, sedatives can worsen breathing pauses. Each pause forces the heart to work harder once breathing resumes. Over time, this strain may lead to high blood pressure or trigger irregular heart rhythms. Slowed breathing may also cause small drops in oxygen that the senior does not fully notice. Repeated nightly events add stress on the heart. Sedative effects linger longer in older bodies because the liver and kidneys clear drugs more slowly. This may cause daytime drowsiness and reduce alertness. Daytime drowsiness can lead to falls or accidents, causing injury and secondary stress on the heart. Some sedatives interact with other medications such as beta blockers, altering heart rate control. The combined effect may cause low blood pressure or an uneven heartbeat. Tolerance often develops. A person may increase the dose over time to get the same sleep effect. This raises the risk of dependence and side effects. Withdrawal can also heighten anxiety or insomnia when the drug is reduced or stopped. Rather than relying on sedative pills long-term, it is better to address habits and routines that support sleep. Good sleep hygiene includes a regular bedtime, limiting caffeine late in the day, light evening meals, and gentle activity earlier in the day. Relaxation techniques or guided breathing may help. In some cases, cognitive behavioral therapy for insomnia shows benefit without drug risks. If a sedative is used, it should be for the shortest period and at the lowest effective dose. A healthcare provider can assess risks such as sleep apnea before prescribing. If breathing issues are suspected, a sleep study may guide treatment such as a breathing device. Monitoring includes checking daytime alertness, any falls or near falls, and signs of irregular heartbeat or chest discomfort. Seniors and caregivers should watch for confusion or memory problems linked to sedatives. These may impair the ability to report symptoms accurately. By focusing on safe sleep methods and using medication only when necessary and closely supervised, seniors can improve rest without quietly adding strain on the heart and breathing systems. Number 6, thiazolidinediones for diabetes. Thiazolidinediones such as pioglitazone were introduced to help manage blood sugar in type 2 diabetes. They work by making cells more responsive to insulin. While they lower glucose effectively, they also cause the body to retain fluid. In seniors, fluid balance is often more fragile. Extra fluid pools in tissues, leading to swelling in legs or ankles. That extra volume makes the heart pump harder. Over months, this added workload can tip a vulnerable heart toward failure. Some seniors may notice increased shortness of breath or reduced ability to walk the usual distance. They may think it is aging or lung issues. Yet fluid retention may be the cause. Beyond fluid, thiazolidinediones may mask early signs of heart stress. A senior might not feel sleepy or fatigued until fluid has already built up. Mild leg swelling can be dismissed as normal. When heart failure symptoms appear, they may follow months of silent fluid gain. This class of drugs also interacts with other diabetes or heart medicines. A provider must monitor weight, heart function, and fluid status regularly. If a senior has any history of heart issues or even mild leg swelling, use of these drugs calls for caution or avoidance. Safer diabetes medicines exist that do not cause fluid retention. If you take a thiazolidinedione, track weight daily and note any swelling around ankles. Keep a log of shortness of breath with activity or when lying flat. Report these to your provider right away. Do not stop the drug suddenly without medical advice. Instead, discuss alternative options such as metformin, SGLT2 inhibitors, or other agents with lower risk of fluid retention. Regular heart checks and lab tests for kidney and liver function help catch problems early. Lifestyle measures remain vital. Diet adjustments, weight management, and physical activity suit many seniors and can reduce the need for higher risk drugs. A care plan that balances blood sugar control with heart safety may involve combining lower risk medicines at modest doses. Working closely with a healthcare team and adjusting treatment as needed can protect both blood sugar and heart health over the long term. Number 7, nonsteroidal anti-inflammatory drugs. Nonsteroidal anti-inflammatory drugs, NSAIDs, include ibuprofen or naproxen. Many seniors use them for arthritis, joint pain, or minor aches. They reduce inflammation by blocking enzymes that produce certain signaling molecules. While effective for relief, they can raise blood pressure and cause fluid retention. For an older heart, additional fluid means extra work. Blood vessels may stiffen with age, making the pressure rise more pronounced. Repeated NSAID use can harm kidney function. With weaker kidneys, fluid balance shifts more easily toward retention. This cycle adds strain on the heart muscle. NSAIDs may interfere with medications for blood pressure or heart failure. They can blunt the effect of diuretics or ACE inhibitors. A senior may find that a once effective heart or blood pressure drug stops working as well when NSAIDs are used regularly. That may prompt dose increases of heart medications rather than checking the cause. Over time, this can destabilize blood pressure control and heart function. Some seniors do not feel an immediate change but develop gradual worsening of heart symptoms. Shortness of breath with activity or swelling in legs may creep in. Using NSAIDs occasionally may be safe for some seniors, but daily or frequent use increases risk. Alternatives include acetaminophen for mild pain or non-drug approaches such as physical therapy, gentle exercise, warm packs, or topical treatments. For arthritis, guidance on joint-friendly activity and weight management may reduce pain without pills. If NSAIDs are needed for brief flare-ups, use the lowest effective dose for the shortest time. Monitor blood pressure and kidney function with simple blood tests. Keep track of any swelling or changes in exercise tolerance. Always inform your healthcare provider about any over-the-counter NSAID use. They can advise on safer pain management plans. In some cases, a selective COX-2 inhibitor may pose less risk to the stomach but similar heart and kidney effects. Even over-the-counter labeling may not highlight how age alters risk. By choosing gentler options first and watching for early signs of fluid retention or blood pressure rise, you protect your heart from hidden damage. After reviewing these 7 categories of pills, remember that many drugs help seniors live better by relieving symptoms or controlling chronic conditions. Yet changes in how the body handles medicines with age mean regular review is essential. Keep a list of all medications, including over-the-counter and supplements, and share it at each visit. Note any new symptoms such as swelling, dizziness, shortness of breath, or heart palpitations. These may signal that a drug effect is emerging. Work with your provider to adjust doses or switch to safer options. Lifestyle measures often complement or reduce the need for certain medicines. A balanced diet, regular gentle activity, good sleep habits, and stress management support overall health. By staying informed, speaking up about concerns, and monitoring closely, you can maintain relief or control while guarding your heart. Your care team can guide adjustments tailored to your health status. This approach helps seniors use medications safely, allowing them to stay active and feel their best without unknowingly adding strain to the heart. Thank you for watching. If you recognize any of these medications in your routine, talk with your doctor about possible alternatives or monitoring steps. Keep a record of symptoms like swelling, dizziness, or unusual tiredness, and share it at your next visit. Using a simple tracker app or a written log can help you spot changes early. If this video helped, share it with friends or family who might benefit, and subscribe for more practical advice on senior health. Leave a comment with questions or experiences. Your input can help others stay alert. Take care of your heart and stay safe.